Okay. Last week we started, I would say, a small module of different infections that can be grouped together as intestinal infections. As well as we discussed, intestinal infections are on the second place in the world by incidence after respiratory infections. So this thing is due to the fact people are not aware, maybe they have to wash their hands. People are not aware maybe about existence of centralized water supply or about centralized wastewater systems. So this issue can affect both developed countries and developing countries, just because even if you have all of those facilities, it is not a warranty you will never get an intestinal infection. So even if we make right now a short and superficial statistic, and I would ask everyone who had ever an intestinal infection, I guess there is no one who wouldn't raise their hand unless they're not listening, right? So probably all of you had ever, and not once in your life, an intestinal infection. But if you don't know what means intestinal infection, or if you are not sure about symptoms of intestinal infection, so if you ever had diarrhea, vomiting, headache, stomach ache, abdominal pain, maybe with fever, all of these symptoms together, or most of them together, will present symptoms of an intestinal infection. So probably all of you and all of us had an intestinal infection, and not once. Last week we discussed about Shigella, about dysentery. It is first but not the only pathogen that can cause an intestinal infection. Today we're going to talk about genus Salmonella. And Salmonella also is able to produce a group of intestinal infections that manifest different in our bodies. They will manifest different in culture media, in different investigation methods. They will be different. So if we are talking about any infection caused by Salmonella genus, we can generally call all of these infections of the entire group Salmonellosis, that can be divided in typhoid and non-typhoid Salmonellosis. What is important about morphology of Salmonella genus, just as other infections, other intestinal infections, most of them, it is caused by a gram-negative, rod shape, usually motile but not all the time, not all the genuses. Some of them are producing capsules, some of them not. Some of them have pili, some of them maybe not. If we are talking about motility, most of Enterobacteriaceae family are motile. We discussed last week about Shigella that is non-motile. They do not produce any spores. And this is how you will see them under the microscope. So the main feature to which you have to pay attention under the microscope in most of intestinal pathogens, you will observe their gram-negative. It is not that easy to observe their shape. Maybe easier to observe their arrangement, but still not too easy. If you are looking at this one, you are not even sure is it rod shape or spherical shape bacteria, right? So it is very important to put together more features of the pathogens. Not just what you can see under the microscope, but also where did you take from the pathogen? Which are symptoms? You put all together all of these data, and you can guess. So even if you cannot see under the microscope its shape, but you can see it is gram-negative because it is red or rose pale. You already know it's gram-negative. You know this sample have been taken from intestinal culture, that is coproculture, cultivation, bacteriological cultivation from feces. It's called coproculture. So if you know all of these moments, you can already guess that this pathogen is making part of Enterobacteriaceae family for sure. You are not maybe still sure is it Shigella, Salmonella, Escherichia, or any other maybe conditionally pathogenic bacteria that also can make part of Enterobacteriaceae family. So its morphology together with symptoms and together with epidemiological picture where it comes from will help you to understand we are working with Enterobacteriaceae family. If we are talking about physiology of Salmonella, physiology of Salmonella will be different between different species. You will see differences in physiology. Different species and different serovariants of Salmonella will manifest different physiological features. What means different physiological features? They have different metabolism. They will consume different micro and macro elements. They will prefer different sugars. They will prefer or not iron. They will produce or not produce gas. So all of these features you will be also able to see where? Already not under the microscope, but in the culture media. In the culture media, you will see different colonies. So as well as you should remember, if we are making investigation for intestinal infection, we take as a specimen feces that contains a big amount of bacteria. We start with selective culture media. Selective culture media, as well as you must know, first of all, reduces the normal flora. Basically, it reduces gram-positive bacteria. So it inhibits growth of gram-positive bacteria. And since we know that most of intestinal pathogens are gram-negative, that's enough for us, for the first step. So we are making investigation on selective culture media. The mostly common is McConkey agar or endo or levin. These culture media are making part of two types. First of all, it is selective culture media because it inhibits growth of gram-positive bacteria. And second, its secondary function is differential culture media, because on this selective / differential culture media, different species and different serovariants will grow, will multiply in different colonies. The colonies will produce different pigmentation inside of colony. So here you can see Salmonella typhi, here you can see Salmonella, as well as I remember Typhimurium, as well as I remember. So on the culture media, you already can make difference between species if you know it is Salmonella genus. Also around the culture, around the colonies, the color of selective culture media also can change. So it will show difference. It will show difference in bacterial metabolism in selective culture media. Different species will show different metabolic features. The second step we are doing, we are selecting the bacteria from colonies we suspect. We retake an example, a specimen from colonies we obtained in selective culture media, and we put them in differential culture media. And differential culture media will have also few components that will show metabolic preferences of different species and serovariants if we are talking about Salmonella genus. For example, just as I told in last lecture, some of them will consume just glucose, just lactose, just sucrose. Some of them will consume all of them. So the color of culture media will change in dependence on consumption. They consume something, they produce something, and the metabolic results of these metabolic products of this bacteria will enter in chemical reaction with culture media and will change its color in dependence on what it consumes and what it produces. Same with iron. Does it consume iron and produce H2S or not? Does it produce gas or not? So if it produces gas, you will see inside of culture media in tube, you will see rupture between two parts of the culture media. So it can actually destroy the culture media by gas production. It will break into halves, and you will see distance. You will see space between two halves of culture media in tube. It is because of gas production. So its metabolic features will show you difference between them. Now you probably know, or you must know, that when we type the name of bacteria, name of species, which includes name of genus and species, you know that we must type genus name with a capital letter and species name with small letter, right? And both genus and species are typed with italic, yes? It is very important. If you will ever, not if, hopefully, when you will make your thesis, when you will make your diploma, by the way, there is very high chance you will discuss there some pathogens, maybe. It doesn't matter will you take it in microbiology or in any other direction. There is a very high chance you will describe some pathogens there. So, if you will not type it with genus with capital letter and species with small letter and both genus and species with italic, everyone will understand you didn't learn microbiology. Okay? But, except genus and species, we also have some types serovariants with their own names. So when we are talking about typhoid fever caused by Salmonella, very often it is said Salmonella typhi, and also we have Salmonella paratyphi A, paratyphi B, that causes typhoid and paratyphoid fever. Not everybody knows that Salmonella typhi, paratyphi A and B, it is not name of species. It is name of serovariant. Not all serovariants have name. Usually serovariants will have some codes, some numbers, but not actually name. So whenever you can see name of pathogen that causes typhoid fever, the correct naming is Salmonella enterica serovar typhi. So you can see that typhi is typed with a capital letter and without italic. It is correct form of typing of the Salmonella. It is just a small tip for your papers in future. So what is important and interesting specifically about typhoid fever caused by Salmonella enterica serovariant typhi or typhi? It is quite different in comparison with other intestinal infections. And this schematic picture is my favorite one that explains the entire disease caused by Salmonella enterica serovar typhi. Basically, it is described in Romanian, but most of words are international, so it is not that complicated to understand. So here you can see a box with incubation period. An incubation period in typhoid fever is between 7 and 21 days. That means it is between 1 and 3 weeks, right? But usually about 10 days. What happens in incubation period? As well as we know, incubation period is that period that starts in the moment pathogen enters the body, and it lasts until we have first symptoms. In this period, some changings are happening in the body. The pathogen is multiplying till that amount that is able to produce some symptoms. Maybe migrates to some spaces, to some places in the body in which it would feel more comfortable to multiply. This is incubation period. For incubation period, no symptoms characteristic. But please keep in mind that incubation period is not part of infectious disease. So So if you are asked about periods of disease, incubation period is not a period of infectious disease. It is a period of infectious process. It is the first part of infectious process. Not every infectious process is a disease, because disease contains or has some symptoms, but infectious process not all the time. Infectious process can turn into infectious disease, but not all the time. So, incubation period is about 10 days. In this period, Salmonella from the intestinal tract can migrate through the bloodstream, through organs of immune system, and will start multiplying. Next period is a period of invasion, or prodromal period. Prodromal period is characterized by non-specific symptoms. This is also, you should remember. Prodromal period, or period of invasion, is characterized by non-specific symptoms. What does it mean? That means that by these symptoms, during these symptoms, you are not able to understand what's going on. For example, if we are talking about prodromal period in typhoid fever, it starts with headache, it starts with tiredness, nothing specific, right? Every day we can have headache, tiredness, anorexia, that means loss of appetite. Please don't misuse with nervous disorder, anorexia nervosa, so-called, that is caused by disorder of like it is psycho. People who are anorexic, that means they decrease their food consumption, they have loss of appetite, they become very extremely sick, skinny. Basically you can see just skin and bones. So it is not the same thing. Anorexia as symptom, it is just loss of appetite. Okay? And as a result, we have constipation, because invasion period is will last about 1 week. So during 1 week, you don't have appetite. You have anorexia. So you never think about an intestinal infection, right? You don't feel good enough. When you don't feel good, you don't have any wishes, right? You want just to take rest because you're tired, you have headache, maybe some uncomfortable feelings in abdominal cavity, but makes sense because you didn't eat anything. So you don't think about an intestinal infection, especially constipation. Even this symptom will make sense for you because you didn't consume anything. So I guess also when you had ever in your life period when you didn't have any appetite, it can get as a result with constipation. It happens. So the patient, the person who is sick, doesn't know yet it is an intestinal infection. Meanwhile, already at least 2 weeks from the moment of infection passed. Do you remember what did you consume 2 weeks ago? I'm not sure. Maybe some of you, if it was something special. but probably you don't remember what you consumed 2 weeks ago. So after 1 week of invasion, we have an acute period. In acute period, in addition to general symptoms, will appear specific symptoms that will help you to understand which is the infection. So some general symptoms can disappear. For example, constipation will disappear because here we already will have diarrhea. And it will make a surprise because you didn't eat too much during last week. And you have diarrhea and you're like, what's going on? I didn't have a chance to get infected with anything. So why do I have an intestinal infection? In addition to that, will increase temperature. So if you can see here the curve of temperature, in period of invasion, it will be between subfebrile and fever, but in the acute period, it will be extremely high fever, over 40 degrees Celsius. And it will like increase and decrease, but in a small limit. Like 40-41 or 39-40, like that. Not too much. It will play. In this period also, except diarrhea, except intoxication, because the pathogen will multiply extremely high, especially in the bloodstream, more and less in the intestinal tract. This is what gives extremely high fever, and also it will give abdominal rashes. So if after a week of constipation and loss of appetite, a person has such symptoms like diarrhea, like general intoxication, extremely high fever and abdominal rash, that's it. It is typhoid fever. It should be clear for everyone. Also, it will lead to splenomegaly. It is enlargement of spleen. And this period will last about 2 weeks. Probably in this period, a person will start making, I guess closer to the middle of this period, the person will start being afraid, because usually when you have an intestinal infection, you never go to a doctor. At least for 2 reasons. First one, you are sure you will handle it soon yourself. And second, you're afraid to leave your house while you have diarrhea. Yes? You need a bathroom around. These are 2 main reasons people are not going with any intestinal infection to a doctor. But if it lasts more than 1 week, you understand that probably you are not able to do it yourself. So you are going to the doctor. Of course, in that period you will hopefully start the treatment. That will lead to decline. That also lasts about 7 days. During the decline period, could happen, not every time, it doesn't mean it will happen 100%, but could happen some complications. So one of the mostly spreaded complications is ulceration in the region of Pierce patches. Do you remember where Pierce patches are situated? Yes. Small intestine. And what is Pierce patches? Pierce patches are lymph nodes of small intestine. So, Bacteria is multiplying in bloodstream, in lymph stream. As a result, they are multiplying in Pierce patches. They make ulceration because they destroy Pierce patches completely. And this ulceration is having opening in the small intestine. As a result, except other symptoms, in decline period could appear bleeding, intestinal bleeding, because of this ulceration. If it is not treated good enough, also it can lead to perforation. It is very dangerous. Perforation is perforation of intestine. So the contents of the intestine can get in the abdominal cavity. When it gets into abdominal cavity, it leads to peritonitis, and this is extremely acute and severe state in which if you don't make anything in few hours, no more than 1 day, but you cannot actually support it more than few hours. If you don't make anything, the patient could simply die because of pain and because of this infection and because of infectious process. It can lead up to sepsis, and the person is gone. So, and also, since it affects bloodstream, it can affect also bone marrow. As a result, it can lead also to osteomyelitis. These complications could happen during the decline period. So meanwhile you are getting better, some things can get worse. And especially if the treatment is efficient enough, the convalescence period will appear after decline period, and it will last about 4 up to 8 weeks. So that means just convalescence period will last about 1-2 months. And during this convalescence period, you can observe that the temperature curve is going up. So during convalescence period, the patient could have up to 40 degrees Celsius after decline. Why it happens? You can observe that a lot of infections, but not all of them, a lot of infections in their name, in their title, have word fever. Did you observe it? Enteric fever, typhoid fever, relapsing fever, hemorrhagic fevers, scarlet fever, and so on. Why all of these infections in their naming, in their title, they have word fever? Meanwhile, basically any infection ever could produce fever, but not all of them are called fevers. What is important to keep in mind? That all the infections that have in their title fever word are multiplying mostly in the bloodstream. Sometimes it will be transitory bacteremia. That means it will not lead to septicemia, to sepsis, and to very fast death. But sometimes it can lead specifically to these results. But but all of these infections, most of these pathogens, they will prefer including bloodstream. Not only, but including bloodstream. As a result, why it is that important to know all of these symptoms? Not only to understand how to make diagnosis and how to treat, but also so not only to make diagnosis and not only to know how to treat. All of them are depending of each other. So when you know symptoms, it is clear for you which is the disease. When you know symptoms, it is clear for you how to treat. But in order to make investigation, you must know which specimens you should take. And in different periods, in different stages of the typhoid fever, we'll have to take different specimens. And here you also can observe it. So what we can start making lab investigation, of course, from first symptoms, starting with invasion period. So mostly we'll find bacteria in the bloodstream in the invasion period and not too much in the acute period. The first specimen we can take from a patient, it is specifically blood. And you can observe that blood culture has the same direction with the blood culture curve has the same direction with the fever. Can you observe it? Here how fever develops, and here how much we can find the blood. The fever will decrease, and the blood the pathogen in the bloodstream will decrease. After that, this line shows coproculture, or presence of bacteria in the feces. So it is closer to the middle of acute period. It shows you how the pathogen migrates from the bloodstream into intestinal tract. And just after that, you can see how much it takes, how long it takes until we will produce some antibodies for an infection. How long it takes until we'll have some antibodies? Usually a few weeks. So the pathogen will not be present all the time in the body. Antibodies will not be present all the time in the body. In the beginning, pathogen multiplies, and after that, antibodies are produced. So, in a few weeks, closer to the decline period, we'll already have some antibodies. And what is interesting, closer to the decline period and for a short period between acute and decline period, we also will have pathogen in the uroculture, in urine. Why? Because of presence of pathogen in the bloodstream. So it migrates from bloodstream, it migrates also in the excretory system. So for a short period, we also can have a pathogen in the uroculture. And closer to the convalescence period, we'll have more antibodies in the bloodstream. So this is how you make difference between periods for investigation. You're asking the patient for how long he is sick, and we appreciate. In the first week, the best specimen is a blood, especially blood for what? We take the blood for bacteriological investigation. That means we are looking for bacteria. Because is it clear that in different situations we take blood for different reasons? Sometimes to find their bacteria, sometimes to find their antibodies, sometimes for general investigation, for biochemical parameters, and so on. So, first week, blood culture. On the second week, already can start appear in the blood antibodies. This is why we can start making for antibodies, investigation for antibodies on the second week. Third week, that makes sense. First week we don't have any diarrhea, you don't have any matter for investigation. Second, and the bacteria will appear, you can see here on this curvature, that bacteria will appear in the intestinal tract in the middle of acute period. You can see it, right? So, first week, second week, third week. The entire third week is a perfect time for investigation of the coproculture. And the fourth week, here, it is perfect time for uroculture, investigation of urine for the bacteria. In this period, you will find in these periods, on these stages, you will find these pathogens in different specimens. Of course, like any other intestinal infection, the first line treatment of any intestinal infection is specifically fluid and electrolyte replacement. That means if the patient is able to drink, the patient must drink at least a little bit more than he or she lost. If the patient is not able to drink, we make intravenous perfusion. What is faster? What will recover the liquid lost faster? Huh? Intravenous? Are you sure?
No, because I know that everything enters the bloodstream is faster. Sometimes.
Okay. Another question: how fast you can drink a liter of water?
The normal consumption is 1.5.
No, my question is how fast. Take a chronometer. How fast you can drink 1 liter of water? I guess it will not take more than 1 minute, probably, right?
But it's not
Right.
good for the digestive system.
I'm asking just about speed. How fast you can do it? About 1 minute. How fast you can make perfusion of half liter of saline solution? It takes a little bit. It takes a little bit, right? So this is why the best way is to drink. It will be faster. You will faster replace the lost. But if there is no chance for some reasons, and we'll discuss these situations a little bit more while we'll talk about cholera. If for some reasons it is not able to, the patient is not able to drink, we will have to make intravenous perfusion. It is much better than nothing. But the best option is to do both. Yes. So, it is the first line treatment. And second but not least, antibiotical treatment. And antibiotical treatment, as faster will start, and specifically it is mostly important to make intravenous antibiotical administration, especially when we are in the first and second week of infection, because bacteria will be mostly present in the bloodstream, mostly in first 2 weeks. And also when bacteria is mostly present in the intestinal tract, also is good administration of antibiotics per oris. So, through the oral cavity. And all other symptomatic treatments. What about prevention? It should be very clear that the first thing you must do is personal hygiene. I like so much in one public washroom, in one public bathroom, I saw the paper on the wall. It was written please don't save the water. It is meaningless. Okay? So, I like it so much. I didn't ever think about it because very often people are saying, save water, please make economy of water. Yes? Don't waste water. And my question is, why? Why should what it will change? And some people are saying, in Africa people are dying because of lack of water. So, what will I change? What will I change if I will make economy of water in my house? What will I change? Nothing. If I would be able to transfer somehow that water in Africa while I'm making this economy, maybe it would make some sense. But I change nothing in a good direction. Meanwhile, if I will waste a little bit more, even 2 times more water I'm wasting every day, even 2 times more, how much it will be? Okay, let it be with 10 euro per month more. I don't think it is much more than if, just as you told, I will make economy on water, I will not waste water, and I will increase my chance and chance of my homemates to get an intestinal infection, and then I will have much more expenses on treatment. So if I compare prevention and treatment, of course prevention is cheaper, not every time easier than treatment. Why not easier? You need to change something in your life. You need to change some habits. You need to change your behavior. It is much easier to do something being forced. I'm sick. I don't have any choice. I have to get treatment. Even I didn't have money, I will find some because I need treatment, right? Even if I didn't have time for that because I need to work, I will find some because I need treatment. Prevention, a little bit later, because you need to change something in your life. So the best prevention of intestinal infection is to change something in your life. Because I'm pretty sure if you, we don't need to ask, because if I will ask you right now, who is washing their hands before your meal? Everybody will say, of course, of course. And probably most of you will lie. Probably most of you will lie if you will say that you are washing your hands before your meal. Maybe unintentionally, but you will lie. Because what you consider as a meal? You consider as a meal when you are coming home, you wash your hands, you go in the kitchen, you make some foods, you put it on the table, you sit on the chair, and you start your meal. It is meal, right? But when you are in the city, running around, when you have short breaks between lessons, and you are entering like running between washroom and coffee shop and any other place, and you take placenta or Snickers or cup of coffee and running forward. Do you wash your hands? Of course not. Of course not. And you will observe that most of you are not doing that. From pandemic, a lot of a lot of people got that habit to have sanitizer in their pocket or in their backpack. Very good. Did you continue using it after pandemic finished? I'm not sure. So you will observe that at least half of your meals you take without washing your hands. Meanwhile, it is the best prevention of any intestinal infection. Just as I told last time, everybody used to say wash your hands during pandemic. Meanwhile, it was one of the mostly useless methods of prevention of coronavirus infection spreading. Useless for airborne infections, for respiratory infections, but not for intestinal infections. You don't need to wear the mask during while somebody has intestinal infection, right? At least for two reasons. You need to sneeze too much in order to to infect someone with an intestinal infection. Too strong sneezing or coughing should be. And second, people are trying to isolate themselves while they have intestinal infection. Even during this semester, I've got few emails with kind of message. Please, could you consider my health issues because I have an intestinal infection? I cannot come in the class. Okay, I can consider it. Why don't you email me about something like that when you have a respiratory tract infection? Why? You're coming. Good if you put the mask, but usually not. And you are coming. No. I have some allergy. Of course, in the cold period, flowers are flowering, trees are. Yes. During the winter, you have allergy for what? Interesting. And even if it is already spring and soon we'll have a period of allergy, does it stop you for getting infected with respiratory infection? Does it mean if you have allergy right now, is it a warranty you don't have any respiratory tract infection? No. You can have both at the same time. This is why it is extremely important to pay attention to prevention. Okay? So if you will do it, and it is up to, it is not even up to you. It is more for generations to come. Why? What is easier, to teach or to re-teach? This is very important. If somebody already has some habits, it is extremely complicated to remove these habits. Basically, it is impossible to remove a habit. It is possible to replace it with another habit. But if the child is small, and you will have some, hopefully, soon, probably, you must teach your child to wash its hands. It's very important. It should be on the subconscious level. It shouldn't be, how many times I washed my hands today? No. When I used to be a child, my mother used to say, wash, wash, wash. Did you wash? Soap, soap, soap. Did you wash your hands? Hands with soap. Go and wash your hands with soap. A lot of, in Russian it sounds a little bit different, like poetry. But anyways, she had that fast talk. Anybody who'll be entering the house, go and wash your hands, go and wash your hands, go and wash your hands. Did you went outside for a while, for a few minutes, you enter the house, go and wash your hands. It's extremely important. So you induce this habit to a child, and he or she is not thinking about, oh, I came back from the outside and I need to wash my hands. Too complicated. When you enter, you already feel uncomfortable unless you wash your hands. This is how it works. So if you will teach your children to wash their hands, how you can teach your children? If you will teach yourself. If you will not teach yourself, you will not teach your children. People nowadays are asking, how these kids are so uneducated. Oh. Did you observe? Did you observe? Too much. Why? Because families are made by an accident, kids are made by an accident, and education is if it is made by an accident. Why? So what are you expecting for? For good education? It is just an experiment. It is not a family. It is not a child. It is experiment. Bad experiment. But now it's funny. But when you get in such situation, it's not funny at all, because you ruined your own life. You ruined the life of your half. You ruined life of your child, and you ruined life of your parents, who will say, "I told you." And people are choosing their profession. How? Well, they're working years to become a doctor, 10 years, even more. And still you can change something if you don't like it. Can you change it if you already made a family and child? You cannot change it. You can abandon it. But did you solve an issue? You just make it worse. So think about it. Don't make anything by an accident, okay? It is that period you must start thinking about that, okay? Good. Make prevention of any kind of infections, including intestinal. That's it for today. Wish you good luck.